And now we have with us a very special guest, Dr. Shweta Mittal Gupta, who is one of the senior most consultants for reproductive medicine, obstetrics, and gynecology in the entire country. Doctor, we are really delighted and privileged to have you here on this show on the occasion of Mental Health Day. Now, tell me something. I'm going to talk to you about postpartum depression, which is very common. At the same time, my assumption is that it is not talked about enough in our country. What would you say to that? And as a doctor, how do you address this through your counseling or through other means? How do you address that?
Hello, thank you for making me a part of this very important discussion. When this topic was being discussed, as even an obstetrician or during the whole antenatal care, this topic is hardly ever discussed. Okay, let's be very honest. We discuss the better part of pregnancy. But yes, of course, we are not there to scare our patients. So if we talk of postpartum blues, postpartum depression, and postpartum psychosis, this is like a sequence. So the mildest form is postpartum blues, where the patient suddenly has a baby, has a lot of hormonal changes, a lot of progesterone has gone low in the body, and she may feel a bit irritable, sleep disorder, there's a baby to look after, the baby is not sleeping at night, and the whole cycle or the schedule is upset. And that's way more common, and it could be as high as even in 50% of women. But if we look at postpartum depression, which is a more severe form, which can go on for more weeks, for a longer period of time, with more accentuated symptoms, then it would be somewhere around 1% to say 10%. But if you look at full blown psychosis, which needs medical intervention, then it is low. It is about 0.1 to say 0.5%. So yes, most important. So prospectively, this kind of a discussion is not happening so frequently in India. I completely agree with it, and it needs to be discussed. At least the part that you can have a lot of mood swings. You need a counseling. So we have a special antenatal class, which is totally dedicated to this, preparing pregnant women, that what they should expect when they deliver, and what they should expect when they have a baby in hand, and what kind of a life or a schedule they are going through. So I think tackling with it. Number two, I feel the nurses are a very important link, who must diagnose it, because we will be coming for rounds maybe twice in a day, but they are with the patient day in and day out when they are in the hospital. So I think they are the most important link, or people who will be discovering this first. So the moment family members will declare, there are certain changes in the woman, she's not able to sleep, or some not able to eat properly, having some mood swings, irritability, people feel hopeless that, they're not able to look after the baby. That feeling comes in. So that needs to be addressed and identified.
Thank you, doctor. And I am myself a mother. And when I became a mother 10 years ago, something that, and all of the things that you say, a feeling of hopelessness, or just not being able to carry on with your own work or career if you've been so independent, and suddenly, you feel you're inside the home, you're not able to go in. So these feelings need to be addressed. And when I became a mother, I had the feeling that there were not enough support groups. Family members often tend to not understand, because perhaps they are from an older generation where these things were never talked about. So what do you do as part of the mental healing and health process of your patients? Do you do anything to talk to older family members, to educate them more, to create larger peer support groups? Because as you said, you will only come on the round, you have so many patients. So what do you do to create round-the-clock support?
Yes. So, the first thing I feel is that the support starts from later part of pregnancy. Now, we are in nuclear families, and the parents or the support may come very later during the pregnancy. So number one, I think a supportive partner is something, with someone who is the most important person. Going with your wife for antenatal checkups, I think, and giving her confidence is something which will tremendously help. Being with her, during her labor process, after even if they've gone through cesarean, Then, fine tuning the family. Things are different. Girls can have different expectations. They don't take things for granted. So even something very simple, what I tell patients is that when your baby sleeps, okay, that is the time you must get rest. So let the baby be with the family member for some time. It is very important in the day having 2 hours of rest in the afternoon, because the feeding schedules are frequent. Mother has to be there. So do not go by the clock. See when your baby is sleeping, and that is the time when you take rest. Get your family members in picture. There are so many, moms who would come in, or senior members, or experienced people, like you are a mom now. I'm sure you can tell your friend what you went through, and talking to your friends. I think discussing, opening up and talking to your friends is something very, very important. So this is how you can make a support group. Even we have some support groups. We have a psychologist in the hospital. We have a psychiatric team, but they can only look after a certain part. But we definitely get in our psychologist. And I think even a postnatal physiotherapy. So, getting that sense of well-being, getting it is very important. So looking after the diet, sleep, family members will definitely play. I can share my experience that my baby was a very preterm baby, remained in nursery for a month. And I give a lot of credit, being working woman, how I could balance my family life and my professional, that my mother came in the picture. And there were so many days where the baby was with my mom also. So I think having a family support and a positive attitude, or from your partner, will tremendously help.
Yes, absolutely true. Partners, the partner's presence and the partner's support counts in the biggest way possible, especially for ladies of our generation. Now, I'd just like to take you back in the process a little bit. I have been reading on the work that you've done, the wonderful work, and you've handled a lot of very high risk patients, high risk ladies who have then delivered babies successfully. Now, pregnancy, of course, is, having a baby is very enabling. At the same time, it involves a lot of mental highs and lows. So when you have a high risk patient who is also perhaps going through mental lows, how do you deal with that in the months ahead of the baby's coming?
So, what we typically see sometimes, during pregnancy, you don't see that kind of a dissociation, but it is seen mostly when they deliver. So, who are the typical candidates or patients who can go through, postpartum? So, if you're looking at postpartum blues, it is kind of self-correctable, little counseling, the right diet, sleep, positive, parenting attitudes, family support will help them. But if you're looking at depression, or to the extent of psychosis, they are mostly seen in patients either they had a pre-existing, already some psychiatric disorder. So that is very important to identify, and the right medication they are on. And the moment they deliver, we must, consult a psychiatrist, must get in picture and have the right medication. So, running away from medication is not an answer. This is one thing. Number two, I've seen this happening more in patients who had very difficult labors, or even if they went to an ICU. So, even in ICU, even non pregnant patients go through depression. So, suddenly, when they are out of their difficult times and handing over the baby completely, all in all, I think is not correct. It has to be a slow process, and there the nurseries come into picture, the family, again I said, come into picture, the psychologist comes into picture, the doctors come. But I think positive antenatal care, and making them go through the right diet and exercise, and giving positive picture, and informing your patients that what they are expecting, during labor, during after cesareans, is very important as a doctor.
All right, I just have two small questions before we end.
Yeah.
One is that we know that breastfeeding is a very important part of the bonding between the mother and the child. Now, and it comes with a lot of emotion also. Suppose a mother is not able to breastfeed, it might cause her mental health to degenerate. How do you advise then?
Yeah. So, preparation of the breast during pregnancy in the later part is very important. And when we have antenatal classes, And this is important, we also have a lactational counselor. So the moment patient is in the later part of pregnancy, lactational counselor can come into picture even after birth. So it is very important that we have a dedicated gynecological ward. So now the nurses are also trained in looking after the baby. Now they need to identify, in countries like New Zealand, I remember, the nurses come home so that patients are looked after, and they tell the patients, okay, you eat and you sleep, and for some hours we are looking after the baby. Now that is not possible in India. We are a very populous country, and I've seen patients going through depression even after many months of delivery, where they do not have the sense of owning their own baby, and they don't want to look after such a difficult, birth or pregnancy, after so many challenges, having some genetic disorders in the babies previously. They've gone through special IVF procedures, and I've seen that happening. So it's difficult, but I think a multidisciplinary approach and a lactational counselor is very important in every nursery, who will teach the right method. Then there are certain medications, then relaxing exercises. So those are very important, because it's all in the mind, right? The lactation starts from the impulses. The more baby will suckle. Also, sometimes I tell patients, you can express the milk and keep it, and take some rest, and that can be fed to the baby in between when the baby is hungry. So you have to have your own adjustments and your own, ways to look after.
Yes, so multi-pronged strategy for overall mental well-being of the mother and the child. My last question, doctor. Now you're doing such wonderful work with your patients all around the year, and of course there is a lot of conversation around these topics. But do you think we really need to have something like a mental health day or a World Health Day, a special day where we talk more about it to, flag these
Yeah,
issues
so
and
we have a mental health day which we celebrated in Gangaram Hospital last year. We need to talk more openly. Earlier, the stigma was that people would, correlate all these things to psychiatric disorders. No, it's very normal. Like in schools, also for all the children, you have a counselor. So you need counselors even in your clinics, in your hospital setups, where people should be sent. Even for IVF cycles, you need a counselor, because somebody who can listen to them in an unbiased or a non-judgmental way. So we need a lot of support groups. I'm sure these kind of discussions will open the minds of patients. They will be more receptive. They would also come forward. Their families will come and discuss, and we are there to help them.
thank you very much, Doctor. So, this Mental Health Day, we are talking more about support. We are talking more about having a conversation. And we are so glad to have you with us here, Dr. Shweta. So, do watch the Mental Health Conclave here on Revsportz and keep supporting this initiative. आरबी के बाद you got pregnant with Avik. तो एक एक्सपीरियंस हो जाता है व्हेन यू हैव वन चाइल्ड, एक एक्सपीरियंस हो जाता है. तो टेल मी अबाउट योर मेंटल हेल्थ और मेंटल वेलनेस व्हेन यू वर एक्सपेक्टिंग अ बिग, बिकॉज जैसे एक एक्सपीरियंस हो जाता है वो रिस्पॉन्सिबिलिटी भी तो होती है ना, कि अभी पहले आई वाज ओनली थिंकिंग अबाउट माई सेल्फ एंड माई चाइल्ड इनसाइड मी पहले प्रेगनेंसी, और अभी तो वो चाइल्ड है, दूसरा आने वाला है. तो हाउ डिड यू डील विथ the pressure of looking after one child, expecting another child? How did you deal with the second pregnancy mentally? Tell us about that.
सेकेंड प्रेगनेंसी के टाइम पे मेरी फैमिली, अगर मैं कहूँ तो देवर लाइक के ठीक है, बेटा हो या बेटी हो, एक बच्चा हो गया, हमें दूसरे बच्चे की मतलब के बारे में नहीं सोचना चाहिए, तुम्हारी हेल्थ इश्यूज ज़्यादा होने लग जाएंगी. बट मुझे अंदर से ऐसे फीलिंग थी कि मुझे मेरी बेटी को एक कंपेनियन चाहिए, वो अकेले अकेले कैसे सरवाइव करेगी, तो मुझे एक बेबी और चाहिए था. और दूसरा, जिस समय मुझे जिस दिन कंफर्मेशन आया था अविक के लिए प्रेगनेंसी का, वो दिन जन्माष्टमी का दिन था. उस साल मैंने जन्माष्टमी के लिए, मैं कान्हा जी की भक्त हूँ, तो मैंने जन्माष्टमी पर कान्हा जी के लिए 56 भोग का प्लान किया था. तो मैं 4-5 दिन से कंटिन्यू 56 भोग बनाने में और उसमें पूरे पूजा में लगी हुई थी. एंड उसी दिन, जिस दिन जन्माष्टमी थी, उस दिन मेरी पीरियड्स की डेट थी एंड आई गॉट मिस दैट. और नेक्स्ट डे मेरा एकदम से हेल्थ इशू हुआ. तो मुझे वो कंफर्मेशन आया कि आई एम प्रेग्नेंट, तो उस दिन मतलब मुझे ऐसे लगा कि ये मेरे लिए और कोई नहीं है, मेरे भगवान का आशीर्वाद रूप में है। तो मदर इन लॉ को या सबको ऐसे था कि अगर दोबारा बेटी हो गई तो ये अकेले कैसे दोनों को संभालेगी, फाइनेंशियली भी उतना मतलब कैसे करेगी दोनों बेटियों के लिए, मतलब बचपन से बेटियों के लिए फैमिली को यही कंसर्न्स होते हैं। और मुझे ये ऐसे था, मन में एक कॉन्फिडेंस था कि जो भी होगा इस बार मैं देख लूंगी, क्योंकि इस बार ये मेरे भगवान का आशीर्वाद है, कान्हा जी का आशीर्वाद है। और अविक के टाइम पे मैं जितनी बार भी गिरी उस समय भी बहुत बार, लेकिन जितनी बार भी गिरती थी मुझे डर नहीं लगता था। मुझे हर बार ऐसे होता था कि कोई बात नहीं, भगवान बैठे हैं, संभाल लेंगे। मैंने सोनोग्राफी ज्यादा नहीं करवाई, सिर्फ 9 मंथ पे जब मुझे 9वां महीना लगा था, उस समय रात को जब मैं नींदों में उठी वॉशरूम जाने के लिए, तो मैं पेट के बल गिरी थी। और मतलब वो एक डर वाली बात थी। उस दिन मुझे थोड़ा सा डर लगा कि शायद अब कहीं अंदर चोट लग गई होगी। मेरी मदर इन लॉ उठी, वो थोड़ी परेशान हुई, सबको बुलाती हूँ, अभी हॉस्पिटल चलते हैं। मैंने उनको तसल्ली दी, मैंने कहा मम्मी आप अभी सो जाओ, मेरे को कहीं दर्द वर्द हो नहीं रहा है, मैं ठीक हूँ, नहीं लगी, पेट के बल नहीं गिरी। उनको मैंने जैसे तैसे तसल्ली दी। मैं पूरी रात नहीं सोई, मैं सिर्फ अपने स्टमक को हाथ लगा के बेबी को फील करने की कोशिश कर रही थी कि उसका मूवमेंट मुझे फील हो जाए, मुझे उसका मूवमेंट फील हो जाए।
और आपको फील होता रहा मूवमेंट?
मुझे मूवमेंट फील होता रहा, लेकिन फिर भी ये डर था कि ठीक है मूवमेंट है, मतलब सब सही है, लेकिन अंदर उसको कोई इंजरी हुई होगी तो वो 90वें महीने पे था जब मैंने मेरी डॉक्टर के पास सुबह गई और मैंने उसको बोला अच्छे से सोनोग्राफी करो और एक एक चीज चेक करो, बच्चे को कोई चोट नहीं आनी चाहिए। और मैंने शायद 2 या 2.5 घंटे लगाए वहां पे अंदर, एक एक चीज डॉक्टर ने मेरे को चेक करके बताई। और जब तक उसको ऐसे नहीं हो गया ना कि मोना 100% बच्चा एकदम ठीक है, तू टेंशन मत ले, तो मैं फिर वापस से मतलब घर आई। एक तरह से उस डॉक्टर ने मुझे काउंसलिंग किया कि नहीं बच्चा ठीक है। तो वो एक दिन था जब बेटे के टाइम पे मुझे डर लगा था गिरने के बाद, अदरवाइज बाकी 9 महीने मैं बेटे के टाइम पे बिल्कुल नहीं डरी, क्योंकि ऐसा था कि ये भगवान का आशीर्वाद है। जब उन्होंने बेटी सही सलामत दी है तो बेटा भी, अगला बच्चा भी जो भी है, बेटी है या बेटा है, वो एकदम सही सलामत देंगे। और सेम चीज हुई डिलीवरी के टाइम पे। डॉक्टर ने पूछा कि बेटी है बेटा है बता, तो मैंने कहा नहीं जो भी है वो बताओ कि स्वस्थ है एकदम। तो बोले कि एकदम स्वस्थ है और राजकुमार जैसा बेटा हुआ है। तो मैंने कहा ठीक है।
So you got a baby Krishna in the form of your little boy, and
Yeah.
Hearing you, Mona, we completely appreciate what an extremely strong woman you are. And listening to you, it's like a lesson for every mother ki jo bhi situation hai, we have to be strong like you were strong. And I can completely understand what your emotional ups and downs were through your pregnancy. It's absolutely great to speak to you. बट एक लास्ट क्वेश्चन, बहुत से एथलीट जो महिला है उन्होंने बोला है कि लाइक फॉर इंस्टेंस सानिया मिर्जा, शी हैज सेड दैट आफ्टर शी हैड हर चाइल्ड, sport ensured mental well-being for her, just because after you have your child, वो breastfeeding का cycle, staying awake at nights, वो that's like a cycle for mothers until your child is about 2.5, so you have to go through that. And sometimes it creates depression in women. You are not able to deal with that. So you tell me, when you were going through that, breastfeeding, taking care of the child, taking care of your own health, as you said you had put on weight, sport aapke liye as a getaway, was it something like that? I have to get back to sport, I have to practice a little bit, keep aside a little bit of time for myself, for my sport, ऐसा कुछ था?
मैंने मेरी दोनों प्रेगनेंसी के दौरान या प्रेगनेंसी के बाद ऑलमोस्ट 1 साल तक स्पोर्ट्स के बारे में नहीं सोचने का डिसीजन लिया था। तो आरवी के टाइम पे मैं ये कर सकी। मैंने 1 साल पूरा अपना मदरहुड को जिया था और उसको अच्छे से ब्रेस्ट फीड वगैरह करवाया था, और मैं स्पोर्ट्स के बारे में नहीं सोचती थी, लेकिन मैं खुद को वर्किंग में रखती थी। इट इज़ लाइक कि मैं फिजिकल एक्टिविटीज़ में इन्वॉल्व रहती थी ताकि मुझे ना मतलब बॉडी एक्टिव बनी रहे मेरी। और मुझे ये पता था कि मैं जैसे ही मेरे स्पोर्ट्स में कम बैक करूंगी, मैं 2 महीने 3 महीने की ट्रेनिंग में अपनी वो सारी चीजों को कवर कर लूंगी। बेटे के टाइम पे ये हुआ कि जब बेटा 2 महीने का हुआ तो मेरे हस्बैंड का एक्सीडेंट हो गया था, तो उनको ब्रेन इंजरी हुई और उसके बाद में वो 3 महीने मेरे लिए और ज्यादा मेंटल ट्रॉमा था। तो जो मदरहुड को मैं जीना चाह रही थी, 1 साल तक मैंने सोचा था कि मैं गेम्स में एंट्री नहीं करूंगी, मैं वो डिसीजन को ड्रॉप करके और मैंने बेटे को मॉर्निंग इवनिंग में ब्रेस्ट फीड करवाती थी, दिन में उसको बॉटल वाला दूध देती थी और फिर मैंने अपना वापस से वो स्पोर्ट्स का जर्नी स्टार्ट किया, क्योंकि मुझे लगा कि अब मुझे फाइनेंशियल सिक्योरिटीज के लिए अपने दम पर ही कुछ करना है। और जॉब वगैरह से आप जिस स्पीड में फाइनेंशियली सिक्योर होंगे ये हम सब जानते हैं। तो आई थॉट ऑफ कि जो स्पोर्ट्स है वो मुझे फिजिकली फिट भी रखेगा, मुझे वापस से इस डिप्रेशन से बाहर भी लेकर आएगा और मेरे बच्चों के लिए फाइनेंशियल सिक्योरिटी भी क्रिएट कर देगा। तो मैंने उस समय मतलब मेरे बेटे को 5 महीने 6 महीने की एज में छोड़कर और मैं मॉर्निंग से इवनिंग तक प्रैक्टिस जाती थी। दिन में मदर इन लॉ जो है उसको बॉटल से फीड करवाती थी। 6 महीने का हुआ तब थोड़ा थोड़ा वो मतलब कुछ सॉलिड चीजें खाने लग गया था। तो ऐसे करके ठीक है, बैलेंस हो गया। लेकिन हाँ, मुझे इस चीज का हमेशा एक अफसोस रहता है कि मेरे बेटे को मैंने, क्योंकि जो मतलब माँ का जो दूध होता है वो जो बच्चों को पौष्टिकता देता है या जो अंदर ताकत देता है, वो चीजें मेरे बेटे को थोड़ी सी कम मिल पाई, तो उस चीज का मेरे को हमेशा दुख रहता है। लेकिन जो मुझे सही लगा कि मुझे आगे बढ़ने के लिए करना चाहिए, और वहां मेरा मेडिटेशन या मैं कहूँ कि मेरी मेंटल हेल्थ ने मुझे हेल्प की कि मैंने अपने आप को उतने डीप ट्रॉमा से 3 महीने के अंदर वापस बाहर निकाला और खुद को एक ट्रैक पे डाला। उस समय मैंने डिसीजन लिया कि अब मुझे वॉलीबॉल से स्विच करके और अब मुझे एक इंडिविजुअल गेम ऐसा लेना है जो मुझे फाइनेंशियली सिक्योर करे, मेरे बच्चों को सिक्योरिटी दे, और तब मैंने डिसीजन लिया था शूटिंग में आने का।
Thank you, Mona. It's been absolutely wonderful to speak to you. And आपने जो बोला कि मेरा थोड़ा सा अफसोस है that I have not been able to, breastfeed my son as much. I think you have lived motherhood to the maximum. You have been a wonderful mother. You have supported your family and you have made the country proud. And you have also spoken about this, understanding and bond between athletes and doctors, how your doctor supported you through your pregnancy, and that is something very, very important. So thank you again, Mona, for speaking to us, and stay with us on Revsportz and watch this conclave on Mental Health Day.